Our recent winds not only uprooted trees, but it also resulted in a number of people suffering from migraines. So we're wondering, are the two connected?
Yeah, joining us now, Dr. Wazni. He's a neurologist with Dignity Health St. Mary's Medical Center. Thanks for joining us this morning. And doctor, I have to tell you, even before the weather person says the Santa Anas are on the way, my wife will tell me she's getting a headache. We're getting Santa Anas. She knows. What's going on there?
Yeah. Thank you for having me. And good morning. So, the issue with the weather is it's a known stressor. So there are a few stressors that we know that can cause migraines, like alcohol, diet, and strenuous exercise. But the one thing that comes into play with the Santa Ana winds is the environment. So that warm, dry weather does trigger migraines. While we don't know the exact cause, we do know that those warm winds sort of heats up our body. And so the way that our body works to cool ourselves down is those blood vessels dilate. And they dilate to increase blood flow to the surface of the skin, thus relieving heat and cooling down our core body temperature. Now, those blood vessels, when they dilate or widen, they are surrounded by nerves. And we feel that those trigger the pain receptors around our scalp, causing the headaches.
Wow. And doctor, nowadays it does seem like any type of sickness, people assume that it's COVID related. So when do you know if it's a symptom of COVID or if it's a migraine or something else?
Yeah, that's a good question. So I usually use the mnemonic SNOOP. S for any systemic illnesses, that'll fall into the COVID. So, if you are having a headache, but you have joint pain, body aches, that would or a running nose, I would start to consider maybe you have COVID. If it's a headache of your normal type of headache that you get, then I would, assume that would be your normal headache syndrome.
And doctor, what do you recommend in terms of treatment, the best way to treat a migraine or a headache?
Yeah, that's a tough question. A lot of people respond differently to medications. Now, I actually do suffer from migraines, and the one advice I'd let everybody know is, as soon as you feel that headache coming on, take medication. Take that Tylenol, take that Advil, take that Excedrin. Don't take it, while it, don't wait for it to go away, because headaches typically don't go away. So if you take a medication right when it starts, you're most likely going to resolve that headache.
Yeah, a lot of migraine sufferers out there. Thank you so much, doctor. We appreciate it.
And thank you for having me.